We're very excited to bring it to you. And this approach is especially vital today as we stand on the cusp of technological transformation that can either widen or bridge gaps in equality, equity, and access. And by focusing both on innovation and intersectionality, we aim to steer these advancements towards a more equitable future. So with that, we begin.
Awesome. Thank you so much. And I do want to mention to everyone that Devina is actually phoning in from India. So we're not 9.5 hours apart, which made the collaboration amazing. So thank you so much for that, Devina. So I think we're late into her afternoon right now, or early evening. And so I wanted to share with you sort of how I encountered the idea, the notion of inclusive innovation. And if I'm looking away from you, it's because I'm looking to people in the room, right? So I encountered this idea really during my time in Haiti. So in fact, I thought that I coined the term. Well, I did coin it because at the time I hadn't heard it before. And I was working as a technical advisor to the president of Haiti, advisor in innovation, science, and competitiveness between 2017 and 2019. And during that time, I was tasked with two big deliverables. One was leading a team. So I led a team that delivered the largest tech incubator in the Caribbean called Alpha Haiti, and still the largest in terms of square footage. And we were also tasked to do a national consultation that would result in a national innovation policy. And now I had done a lot of innovation policy here in Ontario, and I was really trained to think of innovation as a driver of prosperity, really on aggregate terms. And I had a little crisis of conscience, to be honest, because Haiti's GDP per capita is about 3% of Canada's GDP per capita. About half the population is under the national poverty line there, which is about $2.50 US a day. So it seemed like, ethically, right, an innovation policy that wasn't inclusive, right, would be, frankly, the wrong thing to do. And so I responded with what I thought was an original idea at the time, right? Let's have a national inclusive innovation policy. And I also thought that there are many people in my home country of Canada that live in low resource, low opportunity contexts. And so if we could develop an innovation policy, an inclusive innovation policy in Haiti that was adopted, it would in fact be an example for many of the segments of the population in Canada that don't benefit from all the prosperity leaps that we make, as a society. And of course, I was wrong about this. Of course, it turns out that inclusive innovation was a term coined back in 2007, in fact, by a UN economist called Mark Dutz. And he was really working on India. And his idea was that, and here's his definition, inclusive innovation, that is knowledge, creation, and absorption efforts most relevant to the needs of the poor. And of course, had I read this before, I would have just inserted Haiti as opposed to India, and my efforts would have been much accelerated, but I wouldn't have thought as deeply on the matter. So I'm very happy that I did not know this. And of course, so what you're going to hear today is very much enriched by his work as well. Right? So the idea of inclusive innovation is really leveraging equity considerations, right, for improved outcomes. Now, we are at the Dahdaleh Institute for Global Health Research. We'll be speaking more specifically about improved outcomes, improved health outcomes at the population level. But that said, we'd like to make the case, and in our discussions, you'll sort of help us make that case, right? That gender is really just one dimension of inclusion, and the application to global health is just one application area, right? But we think this is something that generalizes across dimensions of inclusion, right? So perceived race, perceived age, country of birth, like those kinds of dimensions. And we also think this generalizes across policy areas, so health, education, economic development, and such, right? So we are really talking about innovation policy with a social justice sort of lens, right? And but we believe that by redefining successful innovation policy based on inclusion, we are actually increasing the likelihood of its effectiveness development. So with that, I think I turn it over to Devina.
Thanks so much. So yes, the critical question of the hour, why should gender matter? And we believe that gender should matter in policy making because it ensures that the needs and perspectives of all demographic groups are considered right from the beginning. And there are sort of three kind of considerations that we can chat about. The first being the context of discovery, which is incorporating gender perspectives early on helps you to frame initial policy questions more effectively. This leads to the development of mature policies, informed policies that often provide a more realistic evaluation around costs, benefits, impact, and hence reducing the risk of unforeseen externalities. When we speak about the context of justification, it talks a little bit about how do we consider gender impacts in a way that ensure a more inclusive evaluation of policy success. It helps us understand how different groups are affected by policies, ensuring that no group is left behind and no group is disproportionately disadvantaged. And of course, trust. By involving a diverse range of stakeholders from the outset, policies can gain broader acceptance, trust. This is critical. It's seen with vaccine hesitancy, which tend to be more pronounced in often vulnerable groups. We learned that the emergencies are not the time to start building trust. It must be established well in advance, and the core way to really establish it is by creating collaborative environments where everyone's kind of needs and perspectives are considered. Move to the next slide. We kind of talked a little bit more about how the inclusion of gender considerations is just not about fairness. It's about creating that pathway to more inclusive innovation overall. You can kind of consider how men and women differently experience symptoms for the same diseases, such as, for instance, heart attacks. This recognition has transformed diagnostic criteria and led to the creation of the awareness campaigns that are specifically tailored for women, resulting in earlier and more accurate diagnosis. Building on tailored health campaigns, I think in the case of osteoporosis, we can see that having it's sort of traditionally been associated with women, research now shows that men are also significantly affected, but often go underdiagnosed. And by using gender-specific and gender-disaggregated data, healthcare providers have been able to develop targeted screenings, treatments, especially for men, which has substantially improved detection rates and treatment outcomes. Moving on. So really, what does a gender-inclusive approach to health policy look like? And we think of it in 5 points, policy adjustments. So we need to revise our health policies to incorporate gender-specific insights, making sure that health interventions are effective for everyone and include everyone regardless of gender and other sort of identity characteristics. This involves updating existing policies to reflect the unique health needs of all genders and to really create an inclusive environment. The second sort of approach has to do with how do we create opportunities for funding when it comes to gender-specific research. So this is sort of a critical need. The funding can support studies and research and the creation of evidence that helps us continually refine and update policies based on the latest scientific findings. The third is, what do public awareness campaigns look like? We think about campaigns being aimed to educate the public about their unique health risks and promote preventative measures, while also working to reduce stigma and norms around certain conditions. Going to the fourth point, it's essential to offer training programs for healthcare providers that cover the complexities and the considerations when it comes to understanding gender differences, treatment responses, and patients' communications. This training enhances the effectiveness of healthcare service delivery by ensuring that providers can really understand and meet the specific needs of all patients. And last but not the least, how do we really implement systems to monitor and evaluate the effectiveness of gender-specific health interventions? This helps us understand and ensure that interventions are meeting the diverse needs, the diverse perspectives and experiences and symptoms that different population groups may experience. And we spoke about a little bit of these examples earlier on 2 slides ago, but here are some use cases. I think before we start here, it's important to note, and we'll talk about it in a little bit as well, that working on gender is, it's not binary, it's a journey, and it's a journey towards creating programs and policies that are gender transformative. And, thinking about disaggregated health data is a first step to that journey as and an essential step, as we spoke about. So, of course, clinical drug trials originally have been predominantly male participants. This has skewed the data and potentially the safety and effectiveness of medical treatments. So how do we really think about understanding and studying gender disaggregated data? A very, very small, simple experience we all have around office temperature or the temperature in an office space or a working space. The standard temperatures were used to be set based on the metabolic rates of men, often leaving women feeling cold. If we think of it from a binary perspective, recognizing this, some offices have now implemented adjustable climate controls and different temperature zones to accommodate the comfort preferences of different employees and all employees. The third example is sort of when you look at skincare products, they've been designed to historically be one size fits all, especially ignoring significant differences in hormones between different genders. Companies have now started to launch product lines specifically targeting people from different genders and people across different identities, addressing concerns from a skin kind of lens instead of addressing it from a binary male versus female lens. And of course, the last one that we spoke about earlier as well, hard disease symptoms. How do we understand how, while they were traditionally described based on male experiences, which has obviously led to underdiagnosis, inadequate treatment, public health organizations have now launched campaigns to educate both the public and healthcare providers on the varied symptoms experienced by men, women, and non-binary people, and basically everyone across genders, such as often something that gets ignored is nausea, jaw pain, and this is supposed the data shows that it enhanced diagnostic accuracy and treatment. And with that, back to you.
Thank you so much. So just building on Devina's intervention, I wanted to sort of share a sort of persona, right? So when we're doing public policy, it's important to have a clear vision of who it is that we're trying to intervene on behalf of, or we're trying to support, or certainly address. And so here's a persona. His name is Jean-Baptiste. His pronouns are he, him. 35 years old. He lives in the capital of Haiti, which is called Port-au-Prince, with a wife and their 2 children. Physically active at work, with a diet rich in carbs, low in protein and vegetables. Low in protein because that's a bit more expensive. Moderate amounts of alcohol and high levels of refined sugar. This is one of the things that really struck me in Haiti. People drink very sweet drinks, like all the time. It's amazing, right? And he also consumes, sweetened juices and cakes. He's healthy, but at risk of high blood pressure and diabetes due to his lifestyle, and which is these chronic diseases are common for older members of his family and community. Loves sporting events, tends to visit health professionals only when absolutely necessary, due to limited ability to pay, but also the belief that men at his age don't need doctors, right? And there are also limited medical services, and checkups just feel like an interruption to work and unnecessary expenses. So we'll come back to this, I hope, as we do sort of our group discussion, all of us, right? But we wanted to sort of bring a persona that, as Devina mentioned, of course, there's a spectrum in terms of genders, right? But even for a gender that is privileged, really, in policy considerations, that's to say a cis male, there's still some things for us to discover, right? Things about beliefs, such as a 35-year-old man, without any aches and pain at this particular time, there's no reason to do a checkup, and I can almost, I must confess, identify with such a, wrong-headed kind of perspective, and also lifestyles that need to be taken into account as one works as a policymaker in terms of improved health outcomes that can be supported by effective policy interventions. And the hook of, for example, the kinds of things that he enjoys with his family, things such as sporting events, right, gives us opportunities to think about where might we find Jean-Baptiste in a state of mind that is relaxed and open, so that certain types of messaging can be shared with him. So really, this is about gender responsive policy across the spectrum, right? So policymakers can use personas, and they often do, to think of the sort of richness of the situation, and then we can apply, techniques such as machine learning to actually gather gender disaggregated data, so we can actually be more effective in terms of outreach, better understand what is likely based on different scenarios of policy consideration, and optimize our resource allocations of attention and, of course, budget. So in the global health context, especially when we think of the global South, where I've taken many of my examples, particularly in Haiti, just leveraging my personal anecdotal experience. Storytelling is actually a very powerful tool. One of the sort of key learnings, for me anyway, out of the COVID situation that we're still on the long tail of, is the need to have trust between policy-making capacity and the communities that are to be impacted by policy-making. You may recall that we had a situation in places like Toronto, for example, where specific segments of the population showed higher levels of vaccine hesitancy. And many of these were actually linked to past trauma, lack of trust in the system because of lived experience, right? Not only because people didn't sort of understand science, right? And so we want to learn from this, and we want to look at ways in which we can speak directly to the audiences that we're targeting with language and in context that are most appropriate. So addressing women directly, right, as among other considerations, certainly in global South context, where family health is often left to their decision making. That is, and also especially for children and older family members. Addressing men directly for addressing social expectations of masculinity on matters of sexual health, prophylactic, substance and alcohol consumption, occupational health, protective equipment, right? And addressing gender minority groups, including US LGBTQIA+ communities, and be sensitive to the need for anonymity, right? And other kind of security concerns when safety concerns are at play. So I want to turn it to Devina to close our presentation, after which we're going to welcome your interventions, questions, and ideas.
Thanks so much. And yes, in closing, while we spoke a lot about gender disaggregated data, and while it's critical for understanding different impacts of health across genders, it's the interaction amongst all of these different dimensions of inclusion that really can enhance our intervention and our initiatives and our programs and policies. Today, our focus has been on how outward-facing policies can kind of incorporate these insights. I think it's important to remember that intersectionality is not about separate and distinct categories. It's about recognizing how various aspects of identity intersect and overlap in complex ways that significantly influence individuals' experiences and needs. Consider Marianne, who identifies as a trans woman. In the context of a specific policy, they may primarily need support as a parent and as a child of a needing parent. It's essential to address all of their dimensions of identity to provide effective and meaningful support to all the various needs across the spectrum. Looking ahead, when we think about internal innovation, a follow-up seminar, we hope will discuss the essential task of innovating how policy is formulated internally, utilizing our own diverse perspectives. This approach aligns with the concept of intersectionality, which we hope to kind of dig into further. And yeah, as
Devina, sorry, you just went mute.
Oh,
wonderful.
No,
go ahead.
Yeah, so
yeah.
As last thoughts, embracing gender intersectionality and transformative design is a continuous journey. And we must focus on progress and exploration, understanding that our goals and outcomes will evolve as we learn more about each other and ourselves and adapt to new insights. And yes, we're excited to be working on this together and to bring this to you. As we said earlier, this is a unique collaboration that brings both of our experiences across innovation, emerging tech, gender, and intersectionality. offering a not so common but essential approach to ensure that our advancements are both impactful and inclusive, effectively bridging gaps rather than widening them. Thank you.
Awesome. Thank you so much. I'm just going to put our emails if you want to take note of that, and you have some papers you think we should read, or some resources you'd like to share. But let's open it up. I'm really excited about hearing from you. How do you feel about what's been said? Can you share your experiences? That can enrich the discussion if you have some questions. So I'll leave this up just for another 30 seconds, and then we'll take this off so we can see your names at least, if not your faces. So any questions, comments? This is wonderful. So you agree with everything we've said. You have no comments. You're taking it at face value. Maybe we put some tricks in there.
Hi,
Oh,
hi,
go ahead,
Jean-Jacques.
Cynthia. Hello, how are you? Thank you for being here.
No worries, no worries. Thanks so much for this presentation. I just wanted to say I really appreciate the approaches that you're taking, and I'm wondering how do you deal with pushback from the government, for example? I mean, there's always that question, right? Like, why should I follow what your recommendations are, even though they're the right thing to do? I mean, there's always, arguments, oh, it's too expensive, it's not the right time, we don't have the people, it's too complicated, I'm afraid of making a mistake, and on and on and on. How do you get over those hurdles? And also how do you make that, how do you put that value proposition to folks so they do the right thing?
So thank you so much. A great question. I'll give you sort of my sort of reaction, and Devina, of course, feel free to jump in. So I have the benefit of having been a policymaker. I spent 10 years doing this work, and I can tell you just anecdotally, what I appreciated is when folks came to us and they started speaking to us as though they took the time to think of our own perspective. So policymakers also have needs, right? And we need to start, I think, to be effective in our own sort of advocacy efforts. We need to take into account what the needs of the policymakers are. And the needs, obviously, this is a context, driven, consideration. But the needs could be needs in terms of timing, depending on where they are in the political and the electoral cycle. If we just talk about the Canadian situation, right? Going to policymakers, federally right now, is very different than having gone to them 6 months ago, because there's a budget that may or may not be voted down, right? So these kinds of temporal considerations that help understand how much attention they can give to certain issues. And I think this kind of practical consideration is important for us as in our advocacy, so we can treat policymakers as human beings that also have careers to manage and so forth, right? But perhaps more substantially, policymakers tend to be good people who want to see improved health outcomes, and they often struggle with the ... between the recommendation an advocacy group would make and getting to that improved health, policy outcome. Here we're talking about health, but just more generally. So I think it's doing the best job we can, right, to show them the numbers, right? So one of the follow-up presentations that Devina and I would love to be invited to make, we'll wait for the invitation from the Institute, right, is to report on progress on the actual methodology that we're developing, right, to be able to show to make the argument, the quantitative argument on, what is the likelihood of reaching some outcomes and why is that, how do we support that argument? Policymakers tend to want to be able to go to their decision makers and say, if you have intervention X, you can expect this range of positive outcomes. And often what happens is we get lost, and I'm speaking really for myself now, Cynthia, sometimes we get lost in our advocacy because we know that we're doing, good work, right? And we hope that, the policymakers can read our minds, and, their level of commitment to the outcome should mean that they follow advice. But of course, if they're doing a good job, they should not do that, right? They should hold us to the high standard of making arguments that are defensible through logic and evidence. And so I think, and again, I hope that there will be a follow-up workshop when we propose some specifics in terms of the methodology to put together the logic and evidence kind of arguments. And so in the context of understanding the needs of the policymakers, we're able to give them what they need to go to their decision makers, and of course not make recommendations on our behalf that will be career limited, right?
Yeah, no,
Anything
that's
you want
great.
to add to that?
No, I appreciate you answering that question, especially, and I'd love to see that follow-up workshop that's all about the strategy. So how do you choose these opportune moments, at what cycle in the election cycle or is the best time to do X or Y, whatever, for example, don't wait till the very end or whatever, or should it be at the beginning or should it be at the end, or like what are the different ways to pull those levers or nudge or poke or whatever it is you want to say, the carrot or the stick or both. Yeah, no, thank you so much for that.
So I think we're on record as having a overwhelming request for a follow-up workshop. That's what I heard. Thank you so much, Cynthia. Thank you. Any other comments or questions? This is very appreciated. We're a small group. I think you can, I'm not sure if there are hands, but you can just go ahead and turn on your microphone. Vanessa, go ahead.
Awesome. Good morning. Great presentation. I thought it was really interesting and really relevant. I just actually had a question about one of the slides. You were talking about the persona, and how like even machine learning can be used to like kind of inform this persona that we want to use when making policies. Maybe could you just describe that a little bit more in depth and like if that has been utilized yet or it's just kind of something that you're hoping that gets utilized? I just found that one interesting.
No, thank you very much. So such work is being done, frankly, not as intensely as one would think, but this is happening. So you may have read in the news, for example, the argument that the NDP government made here in Canada federally for funding specifically for sexual health products. I can't remember what the exact policy was. There's two things that the federal NDP, takes credit for forcing the government, right, to put in its budget, right? So one was dental care, right? Mm-hmm. And the other one was a sexual health initiative. But does anybody remember what the specific initiative was? Contraceptives is what it was, right? And so the machine learning tools that would justify this kind of policy intervention is exactly about gender disaggregated data gathering and analysis, right? And then understanding and trying to see the patterns. So presumably the argument is that there are patterns in the data that show that there is a lack of access to contraceptives because of cost, because that's what the policy intervention is here, right? That is resulting in some suboptimal outcomes, like societal outcomes, right? Now, I'm really happy you asked the question, Vanessa, because it gets me the opportunity to, and I know I'm not putting you on the spot, I hope, but Vanessa is actually a newly minted, graduate student at the Institute, and she's going to be working with me and, on surprise, surprise, Vanessa, developing exactly this kind of thing, right? So I'm super excited that you're here and very happy that you're part of the team. And Devina is also very excited to meet you, and we're going to have fun together.
Awesome. Thank you so much.
Good. Any other questions or comments from anyone? We have lots of time, so don't feel shy that you're going to take time away. We have a good 20 minutes for questions and comments and hearing your suggestions or experiences. And again, just go ahead and unmute if you're ready to speak. Oh yeah, we have someone in the room. Teresa, go ahead.
Devina, I was curious of what your experience was like. I believe you're in India right now, and hearing Jean-Jacques' reflection about, a couple years down the line, hearing about Dr. Roth's work, how was your interaction, or how did you come to find out about his definition of inclusive innovation?
I am so sorry, I can't hear you very well. Do you mind typing it out? Or I don't know if the mic is very strong.
Maybe, no, I know what's happening. I think, you have to speak there?
Yeah, I was just, is this a little better? Yes, okay, I think you're muted as well.
Yeah,
I was curious about your knowledge and experience and how you came to know about Dr. Rotz's research about inclusive innovation. How did you come across that term? Is it well known in India?
Oh, this is a great question. We actually happened to collaborate at a AI for Global Health kind of consortium. I work with a couple of organizations in this space, and that's how I met him, and that's how we kind of decided to collaborate with them.
So you didn't have that aha moment that you were working on it for a couple of years.
Well, I think we only started working together a couple of months ago, so it's fairly recent, but good.
Yeah, so I think maybe the part of this, so it's a great question, Teresa, thank you. And while the term's being coined, inclusive innovation, and a lot of good work has been done, I found out, right, in this space, especially applied to the Global South, it's still surprisingly to me not very widely used. And this is one of the reasons why I think we're excited about this. We think there's still a lot of potential, benefits to get out of that perspective. At some level, it's very simple, right? It's like, of course, we need to speak to the audiences that we want to positively impact. And of course, we need to disaggregate so we're able to understand what makes them similar, but also what makes them different, right? So of course, this is the case. But nevertheless, for all kinds of maybe legacy reasons, policymakers tend to want to be in a room like this with the door closed and get the policy to a certain level of maturity before they feel comfortable opening it up and having discussion with stakeholders. And I understand this as a former policymaker myself, because it can be risky, right? To start floating wild ideas, especially when you attach numbers to them, right? And then somebody says, well, we started saying we're going to put 10 billion towards this. Why are we at like $500,000, right? Or we said that we were starting the discussion saying we're going to help, we're going to intervene on behalf of Group A, and now we're talking about Group X, right? And where's Group A? So there is actually a two-sided like change that needs to happen, right? So that policymaking can also feel, safe, right? To have a diversity of voices included much early on. Ideally, policy selection would happen with inputs from various groups, right? And that's really something that we hope we'll also be able to speak a bit more about. So that's an excellent question. So inclusive innovation continues to be, I think, this continues to be an opportunity to speak more about it and to get more from it. Thank you so much. Thank you. Now, who has some suggestions for us? Things that that you feel maybe we could have, as we're doing our work, we should pay more attention to, or maybe you have some case studies that you'd like to point to that we may need to consider. At least you think would be enriching for us, or anything along those lines. I mean, I can see from the list of names here that we have some really powerful people, and we would love to benefit from you.
I have some comment.
Yes, thank you, Agnes. Go ahead.
Yes, thank you for the presentation, Devina and Jean-Jacques. I was thinking about the fact policymakers now in Canada, I speak for the Canada, they have a gender-based analysis on every time a policy arises, or a research is done, they ask that we pay attention to the gender-based data analysis.
That's right.
Framework that they provide on its own. But I would like to know, what do you think about this gender-based analysis? Because if you propose something else, it's maybe because this gender-based analysis do not capture exactly what could be an inclusive innovation, what could be the outcome on so on. Also, when you are talking about gender, of course you discuss intersectionality, but I would like to know how you understand intersectionality also, because gender, the way in which you present that seems really binary, on how you incorporate other kind of situation, other kind of identity, other kind of vector of preparation that create specific barriers to social innovation?
Yes. Thank you so much. These are, I think, two amazing questions. So let's start with the harder question first, because if I can survive that, then the other one is easier. So we did intend to speak of gender as a spectrum, and I can accept that we need to be more explicit about that, right? So of course, we don't think of gender as a binary proposition. Perhaps what may have given the impression of that is we did want to also emphasize that even when one looks at the sort of more privileged gender identity, which is cis male, even there's opportunities for more archaeological work that can provide a better policy outcome, right? But we absolutely, will be more careful about emphasizing the spectrum aspect of gender, because that is our intention, right? And Devina, I'm gonna, leave some time for you to also comment, but I want to address the other question as well, because it's more of a Canadian question, right? The GBA plus, kind of policy imperative that happens at the federal level. So there's a gender-based analysis, the plus being to recognize that there's a spectrum of genders, I think, right, mainly. So I think it's an excellent policy sort of, approach that the federal government takes. I would say, just based on my own knowledge and my own experience, filling out, like templates and meeting that criteria, that we'd want to encourage the federal government to go even further upstream in terms of its gender considerations. So it's a good first step. It's an amazing first step. I mean, when I was doing policy making full time for the Ontario government, we didn't have that, and it's not that long ago, right? So I think it's an excellent sort of intervention by the feds. But even further upstream, right? Let's think of gender considerations as we select policy areas, right? That are not only like directed to a particular gender identity, right? Let's think of gender, gender-based analysis in other social policy areas, right? So that's where I hope that we can intervene in this dialogue about, and of course, from our perspective, from the perspective of this presentation, gender is one dimension of inclusion, right? So intersectionality is of course above the range of gender identities, but it's also about all the other dimensions of inclusion. So examples like perceived race, right, is a dimension of inclusion, right? Country of birth, right? Language spoken at home, right? So, and that's going to be context dependent in terms of its relevance. And this is where the methodology that we're developing is really about identifying these different dimensions and finding ways to contextually weigh them to get some kind of prediction as to what their impact might be on policy outcomes. So thank you for a very rich question. Devina, I'm not sure whether you wanted to add anything to that.
No, I think that was great. I'll just land up repeating what you said, but I do think that as much as working on gender and intersectionality for organizations and policymakers is a journey, I think we hope to use that same approach to continue with these seminars and understand how we can keep going deeper and deeper into the layers and sort of understand the different kind of cross-sectional and intersectional aspects of gender identity and inclusion at large. And how we can kind of unpeel the layers of that metaphorical onion and think a little more about what are the challenges, what are the needs and aspirations. So yeah, thank you. Thanks for the question.
Thank you so much. Just to comment, another comment is, in fact, what when I heard you, I believe that maybe a methodology will be, maybe it's a question of word, but methodology, or do you intend to create a framework that will be using to public policy, or is it only a methodology? It's a question of maybe terminology, but
yeah, that's an interesting distinction you're making. So what we mean is to propose an approach that can guide policymaking. So would you call that a framework rather than a methodology?
For me, it's more framework.
Well, you know, we'll use the right word to hook policymakers, but that is the intention. Yes, thank you so much. So we probably have time for maybe 2 or even 3 more interactions. We want to give you, you know, as much value as we can within this hour. So any other, and thank you, Agnes. This is exactly the kind of intervention that enriches all the interventions we've had so far. Really enrich our conversation. So are there any other comments, questions, suggestions, things that, you know, maybe felt a little bit unclear or unprecise, right? We really would appreciate your guidance, because the next time we do this, we will certainly be integrating the conversation that we're having here. That's why we sort of went quickly through the presentation, so we can have lots of time to learn from you. Okay, well, I think it's okay to finish, you know, with 10 minutes to go. I think, you know, is this a record at the Institute? Maybe we've done a great job. Thank you so much. I'm personally so happy that we did this. You know, like our director wasn't able to be here. Normally he's here. And we sort of struggle as to whether we push through and do this, and we decided to do this. And it was certainly very enriching for me. So I thank you for your time. Devina, if you have some final words.
No, this was great. Thank you so much for your time and for your questions and for kind of participating and being a part of this. We're really excited to take this forward and hope that there are many more to come. Thank you.
Wonderful. All right. A great day, everyone. Thank you. This will be, I think, on the website, right, at some point.
Yeah.
So if you're missing us and you want to review some of the presentations, you'll be able to go to the Dahdaleh Institute for Global Health website, and you'll be able to see that. Thank you. Thank you, Michael. Thank you, everyone. Thanks, Vanessa. Rachel, thank you. Oh, Onika, you have a question?
Maybe on the way by.
Oh, maybe it was a wave goodbye. All right. Cheers. Thank you, everyone. Thank you, Rachel. Thank you. Victoria, thank you. Thanks, Devina.
Thanks so much.
I really appreciate it. I had such a great time doing this with you. We have to fly you in, or you have to fly us. I don't know. The whole Dahdaleh Institute is coming to India, right?
That would be great.
Yeah, let me know when you're in North America the next time. We'll figure something out.
100%, I will. 100%.
Yeah.
Should.
Cheers. All right.
See you. Bye.
Bye-bye.
Thanks, everyone.
Thanks.